The risk factors for thyroid cancer vary, but what has been proven is exposure to radiation, especially childhood exposure, and genetic factors, as well as previous thyroidoma or benign thyroid nodules. Therefore, it is necessary to prevent the outbreak by avoiding the known factors, and if there are factors that cannot, such as heredity, it should be detected early and treated immediately. When you are young, avoid radiation on your face and neck if possible, and if you cannot avoid it, such as treating malignant tumors, you should carefully check for thyroidoma or other symptoms. If you have a family history of thyroid cancer, you should be more careful. In particular, if you have a family history of thyroid water cancer, all members of the patient's family must check for mutations in the RET gene to perform preventive thyroidectomy if any abnormalities are found, and check for multiple endocrine tumor syndrome. Nothing is known as a particular risk factor in relation to diet, and nothing is known as a protective factor except iodine and cruciferous vegetables. People in Korea enjoy eating seaweed rich in iodine, such as kelp, seaweed, and seaweed, so it is rare to lack iodine. Vegetables such as cruciferous fruits are rich in antioxidants, so eat them evenly. Also, not eating too much to avoid obesity and exercising properly also help prevent thyroid cancer. Smoking is known to be effective in preventing thyroid cancer, but instead, the risk of other cancers such as lung cancer and laryngeal cancer, which have a worse prognosis than thyroid cancer, increases, so it is recommended not to smoke. In addition, oral contraceptives are mentioned as a risk factor for thyroid cancer, but the association is not clear. It is not recommended to stop using oral contraceptives to prevent thyroid cancer.